Hi, in this video I'm going to be talking about heart attacks. So what is a heart attack? When the blood flow that brings oxygen slows down or completely stops, this will make the heart starve for oxygen and nutrients. When this happens, there's a good chance that one of the parts of the heart will get damaged or even die. This is what we call a heart attack. What are some causes for heart attacks? The first and common cause of heart attacks is called the coronary heart disease. This is when plaque, a waxy substance made from various things that circulate in your blood, such as calcium, cellular waste, and etc., builds up in your coronary artery, a pathway that carries blood to the heart. When plaque builds up in your coronary artery, the heart will starve for oxygen and nutrients. When this happens, a portion of the heart will get damaged or even die. Another cause of a heart attack is called the coronary artery spasm. This is when a severe tightening or contraction of a coronary artery happens. This tightening can happen if you take certain drugs, have emotional stress or pain, or smoke a cigarette. Anyways, when this tightening of a coronary artery happens, the blood flow might stop. This will make the heart starve for oxygen and nutrients. This will eventually cause damage or... What are all the symptoms for recognizing a heart attack? Symptoms might include feeling your heart skipping a beat or beating too rapidly, feeling that it's difficult to breathe, chest pain, coughing, nausea, vomiting, dizziness, face getting a little gray, not feeling good, clammy, sweaty, and restlessness. Now, what are some methods of diagnosing a heart attack? Symptoms might tell you that it might be a heart attack, but diagnosing a heart attack is making sure that it is a heart attack. You can also use certain gadgets or techniques for diagnosing a heart attack, such as an ECG, cardiac enzyme tests like blood tests, and a chest x-ray. What are some treatments for heart attacks? CPR is the most well-known treatment for heart attacks. Another treatment for heart attacks is 300 milligrams of aspirin. This helps the clot in the blood system from growing. Also, thrombolytics is another treatment for a heart attack. This dissolves the clot in the blood system. For very big and bad heart attacks, surgeries have to be done. What are you supposed to do after you just recover from a heart attack? A person who just recovered from a heart attack tends to fall into depression or experience psychological difficulties related to anxiety or anger. It is always best to have 1 or 2 days of bed rest after a heart attack so the heart can heal. But staying in bed for too long can also prevent the heart from regaining strength. On the 3rd day, you can be able to walk, but you shouldn't strain yourself or lift heavy objects for a few months. How do you prevent heart attacks? That's why it's always best to keep yourself healthy from the start and maintain it as you get older. Eating a balanced diet, not taking drugs, not smoking, staying fit, and staying in good shape are all vital to being healthy. This will decrease your risk factors and increase your chance of not experiencing a heart attack. Who is at risk of experiencing a heart attack? Chances of heart attacks increase as you get older, but chances of heart attacks greatly increase for men in their 40s or more. For women, the chances of heart attacks greatly increase when they're in their 50s or more. But people in their 20s or 30s might also have a big chance of experiencing a heart attack if they smoke, take certain drugs, or have other bad habits. Also, if they only get a little sleep or if they're not in good shape, they also have a good chance of experiencing a heart attack. Although, sometimes even if you keep yourself healthy, you might not be able to escape from experiencing a heart attack. If someone in your family, like your parents or grandparents, not your siblings or child, had a heart attack, you will also have a good chance of having a heart attack. This is due to heredity.